Assalamu alaikum everyone. I hope all of you are doing well. In this video I am going to talk about hyperprolactinemia. We know that the normal level of prolactin in men is less than 20 nanogram per ml of serum, while the normal level of prolactin in non-pregnant women is less than 25 nanogram per ml of serum. Prolactin level in pregnant women is in between 80 and 400 nanogram per ml. When the prolactin level increase from more than 20 nanogram per ml of serum in men, or when the prolactin level are increased from more than 25 nanogram per ml of serum in non-pregnant women, or when the prolactin level is more than 400 nanogram per ml, we will call it hyperprolactinemia. So this is the definition of hyperprolactinemia. What are the causes of hyperprolactinemia? The one and the most common cause of hyperprolactinemia is prolactinoma. This is the pituitary lectotrap tumor, which actually increase the production of prolactin. The other is medication. The medication include antipsychotic and dopamine antagonist. These can cause the prolactin level to increase in the serum. The other is pregnancy, in which there is naturally prolactin level is increased in the serum. So the fourth cause is the renal failure, in which the clearance of prolactin from the serum become decreased. So there will be elevation of prolactin level in the serum in the renal failure. Cellular mass lesion, which is the lesion just above your cellular tarshita. And the last one cause of the hyperprolactinemia, hypothyroidism, and the other is idiopathic, in which the causes are known. So now what are the clinical features of the hyperprolactinemia? Remember that the prolactin inhibit the pituitary FSH and LH secretion. So the clinical features in men and women will be due to decreased production of these hormones. So the clinical features are divided into clinical feature in men and clinical features in women, while the clinical features in women is further divided into premenopausal and postmenopausal. So the first clinical feature in men is hypogonadism. Testosterone cannot be secreted from the testes due to decreased FSH and LH, which are inhibited by the high prolactin level. The other is decreased libido. When the testosterone become decreased, there will be decreased libido. And the other is infertility. So the fertility of a male depend upon the level of testosterone. When the testosterone become decreased, there will be infertility. And the other is impotency, which is also occur as a result of decreased testosterone. So the other features are the paracellular signs and symptoms. For example, there may be visual field effects and there may be headache. So the clinical feature, and I have already told that the clinical feature in women is divided into premenopausal and postmenopausal. Premenopausal clinical features include the menstrual irregularity, because the FSH and LH are inhibited by the high prolactin level. There is no FSH and LH secretion, there will be menstrual irregularities. For example, there may be oligomenorrhea or there may be amenorrhea. So there will be an ovulation. Ovulation is occur under the action of FSH and LH. So when there is no FSH and LH, there will be no ovulation, and there will be infertility as well. When there is no ovulation, there will be infertility as well. Decreased libido and dyspareunia, which is the painful sexual intercourse. The other is vaginal dryness and risk of osteoporosis. Because when there is no FSH and LH, there will be no estrogen and progesterone. So there will be a risk of osteoporosis due to decreased estrogen. The other is galactose, which occurs as a result of increased prolactin level. Menopausal one, in which the woman in which the menopause has occurred, so there will be no menstrual cycle in the woman at all. So the only sign and symptom in the postmenopausal woman are cellular signs and symptoms. For example, there will be visual field effects and there will be headache. So now how to diagnose the hyperprolactinemia? Hyperprolactinemia can be diagnosed by taking the history and doing the examination and doing the investigation. So when you going to diagnose a case, always start from the history, then proceed by the examination and then do the investigation. For example, by taking the history, the patient may tell to you about the decreased libido, about the impotency, and about headache, and about oligomenorrhea or amenorrhea. Second thing in the diagnosis of hyperprolactinemia is the examination. For example, you do the examination of the eye. If there is a visual field defect, you will suspect that there may be prolactinoma, and there may be glucturia and there may be vaginal dryness. So this thing can be known by doing the examination. The other is investigation, in which we actually do the prolactin level in the serum. Hyperprolactinemia will be diagnosed when the level is greater than 20. So now how to treat the hyperprolactinemia? The hyperprolactinemia can be treated by treating the underlying cause. For example, if the underlying cause of the hyperprolactinemia is the prolactinoma, then give the patient dopamine agonist, and if the signs and symptoms are not relieved with the dopamine agonist, then you can go for the surgery. If the underlying cause is the medication, avoid taking the medication. For example, avoid taking the antipsychotic or taking the dopamine antagonist. For example, if it is renal failure, then treat the renal failure. For example, if it is due to hypothyroidism, then treat the hypothyroidism. So this was all about on hyperprolactinemia. For more videos, subscribe, like and share. So thanks for watching the video.